name is Dr. Joanna Rhodes. I am currently the Director of Lymphoma and the Systems Head for Lymphoma at Rutgers Cancer Institute of New Jersey and RWJ Barnabas. My specialty is taking care of patients with lymphomas as well as chronic lymphocytic leukemia. I got into lymphoma research when I was a fellow at the University of Pennsylvania. While I was there was when CAR T-cell therapy became FDA approved for patients with acute lymphoblastic leukemia as well as diffuse large B-cell lymphoma. And watching these innovations really inspired me to want to improve the lives not just of patients with lymphoma but also with chronic lymphocytic leukemia by bringing clinical trials to the patients that I get to take care of. My philosophy for patient care is that no two patients are alike. And so I treat every patient the way that I would want my parents to be treated. Each time I meet a new patient, I try and get to know them to understand what their values are and be able to find where their values and treatments for their disease intersects in order to be able to provide patient-centered care. Cellular therapies have been an amazing advance in the treatment of different lymphomas. My role as the director of the lymphoma program has been to partner with our bone marrow transplant and cellular therapies group in order to bring clinical trials for cellular therapies to Rutgers Cancer Institute of New Jersey. Recent clinical trials have demonstrated that cellular therapies are incredibly important for patients that have relapsed large cell lymphoma. And so I think it's an amazing opportunity for us here to be able to bring not only FDA approved cellular therapies to our lymphoma patients, but also new novel therapies as well in the form of clinical trials. I think it's one of the advantages of coming to Rutgers Cancer Institute of New Jersey is that all of these potential therapeutic options will be available should you need them as part of your clinical care. Right now in the lymphoma program, we're in the process of opening up many unique, innovative clinical trials for patients with different types of lymphomas, whether it's for patients with Hodgkin's lymphoma, non-Hodgkin's lymphomas, B-cell or T-cell lymphomas, or chronic lymphocytic leukemia. Some of these are new cellular therapies. Some of these are combinations of drugs that we already know are highly effective in these diseases with the goal of trying to reduce time on treatment as well as side effects from long-term treatments.